Welcome, Dan Williams, and as promised, we're going to do epistaxis. What in the world is that? Epistaxis is a nosebleed, and about 60% of individuals will get one in their lifetime. But what if you get a nosebleed and you're backpacking, camping, hiking, hunting, fishing, and you can't get back for a while? So we're going to address how to stop a nosebleed in the outdoors. Here we go. So what's important, if you look at the diagram that I have here, is there's an anterior and posterior nosebleeds. Anterior nosebleeds are in the first section of the nose, and it is the arteries that are right on, I get to pick my nose on the video. The nosebleeds are right on, the septum runs down your nose. And so these vessels are right on this side, and the tissue is very friable and tender. Posterior is they're farther back, and those are more serious. Very common in kids, very common with dry air, high altitude. This winter, I'll probably see 50 nosebleeds at the clinic. So a posterior nosebleed, we're going to get those out of the way right away. Those are more serious. How you're going to know if you have a posterior nosebleed, if you can't stop the bleeding for a good 20 minutes, or if the blood consistently runs down the back of your throat. Those are two concerning signs that you need to get into a ER, urgent care, to be seen. So individuals at higher risk for nosebleeds, pregnant women, their vessels get engorged in their nose, people that have history of allergies, people that chronically pick their nose, people that do a lot of cocaine, and individuals that are on blood thinners, aspirin a day, warfarin, Coumadin, that are on those meds, they're going to be a higher frequency of nosebleeds. Hypertension that's not controlled. So those are some concerning factors. Today, we're going to address the most common, which is the anterior nosebleed, and how you're going to stop that. What do you expect to happen if you come into an ER or clinic? If you go into an ER clinic and you've tried holding your nose to stop the nosebleed, this is a nasal tampon, and we use a nasal speculum that you'll see here, and that nasal speculum is used to open the nose so I can see inside and see where the bleeding is coming from. And the way this is done is put a little Vaseline on this. It has a little balloon inside. It's inserted into the nose all the way back, and yeah, it's a little uncomfortable. And then this end, a syringe is placed, and we inject about 3 or 4 cc's of air to keep it in place. This is taped to the side of the face, and the individuals will go home. They'll come back the next day, sometimes in 6 hours, and we'll remove it, and the pressure has stopped the nosebleed. That's used in serious situations where usually the person's on a blood thinner and I can't get the bleeding to stop. So what are you going to do if you get a nosebleed? You're out backpacking, hiking, your friend in front of you is walking, he doesn't hold the limb, he lets it fly loose, thwack, it hits you right in the face and you have a nosebleed. So after you're done cussing him out, you're going to sit down, you're going to pinch your nose just below that bony prominence here, and you're going to hold it for at least 10 to 15 minutes. And that's a long time. Most people do not do that. It should be timed. And that is very successful. You're going to have your head down, not back. And the reason for that is so this blood doesn't drain down the back of your throat, then you're going to get nauseous and you're going to throw up. So you bring your head down, pinch that nose for 10 to 15 minutes. On a posterior nosebleed, you're going to feel that blood drain down the back of your throat, and so that's a warning sign. And then everything I'm going to show you, I've talked to you before about keeping in your medical kit. Some Benadryl works as a nice anesthetic. Now, you're not going to carry a huge bottle. And as you see here, you can take plastic straws and cut them and you'll see in the video there that you can keep those in your med pack. All right, so you're not going to be taking a bottle of Benadryl out in the woods hiking or backpacking. So what you need to do is, we're going to, and I'm sure you have seen this in other videos, we're going to make straws filled with the Benadryl so you can keep these in your pack. You're not going to need a lot of Benadryl for your nosebleed. So you're going to cut a straw, plastic straw. I'm going to melt one end of it. I'm using the Leatherman P4 here. So you heat that up. Hold that tight. And you have a nice, if you can see that, a nice seal there. I like using an eyedropper. And you're going to fill this little straw up with some Benadryl and leave you enough room. Clamp that down. Melt the end of your straw. Nice and hot. Grab it. Hold it tight. And we will see. Do we have a good seal? We do. So it's not leaking anywhere. It is leaking right there. You definitely want to check that. So we're going to tighten that again, hold that. And that's really important. You don't want the Benadryl seeping out into your pack. You can even put these in a little plastic bag to make sure. About 4 seconds, and now it's tight, and now you have a seal. So there, you can take this, put it in your med kit, and you have your Benadryl. You can use this for anything, really. Now, you're also going to have Afrin, and you should have a little container of Vaseline for your cotton balls. And what you may not have is a little medicine cup container. And that's fine. You can use any other container that you have. You can even use a plastic bag. So what I've done is I've cut a cotton t-shirt. Cotton is fantastic. And in a very, very narrow strip. I take that, I put that into my little medicine cup, and I am going to squirt some Afrin all over that. Now, what is Afrin? It has that, remember, it has oxymetazoline in it. And that is going to saturate that cotton. And what does oxymetazoline do? It is a vasoconstrictor. Then I'm going to take just a dab, and this is for comfort only, of Benadryl and soak that in the cotton. So now we have a concoction. You're doing a little apothecary here, pharmacy stuff, and you're going to mix that up. Now, a lot of times in the clinic I'll use some 1% lidocaine gel, but we don't have that, and you're not going to have that out there either. Now, you're going to pack your nose with this. This has a high success rate. Little Vaseline is important because if you put this and leave this in your nose on a severe nosebleed and it starts to slowly dry out and then you remove it, the area that was bleeding has scabbed over, you remove it, you break the scab open, and you're bleeding again. So you take a little Vaseline and coat the inside of your nose, just like that. Okay, there you go. Now, what we're going to do this just like you would do it in the woods. I have a twig. It'd be nice to have a cotton tip applicator. You're going to take this cotton, you're going to put it in your nose. It's got Afrin on it, and it has the Vaseline that you put in your nose. And you're going to, it'd be great if you had a peer to do this, but if you don't have a peer, you definitely can do this. And you're going to keep pushing and pushing and pushing this up your nose and you're going to pack this all the way into your nose. And I have another strip in there, as you see. A little bit uncomfortable. It does not burn, and you're going to leave that. And you keep packing that. And you can leave this in there up to 4 or 5 hours, whatever it takes. And because of the Vaseline, it's not going to stick to the area that was bleeding, so it will not reoccur. So this is the best way and quickest way to stop a nosebleed. Got a few things working for you. You got the diphenhydramine that's going to numb the area. You got the Afrin, which is fantastic. It's going to constrict the blood vessel. And you got pressure. So you have all three mechanisms working for you. And then you're going to remove it. And there we go. All right, guys. That is how you stop a nosebleed in the backcountry. Glad I got that video over with. All right, if you have any questions or thoughts, throw it down in the discussion below. If you like the video, give me a thumbs up. We welcome you to subscribe so you'll get notified on all the wilderness medicine techniques and gear reviews. Take care, keep your eyes on the horizon, your face to the wind. Bye-bye now.